Okay, I think we're at time now. Thanks very much for joining us. We're thrilled to be able to welcome you to Responsible Disruption and our 8th Innovation Table Zoomcast. My name is James Gamage, and I'm the Director of Innovation and the Social Impact Lab at the United Way of Calgary and area. And we are excited to welcome our guests to part 2 of our virtual talking circle on the Indigenous perspective on the COVID-19 crisis. Before we begin, I would just like to acknowledge that we are currently gathered on land adjacent to where the Bow River meets the Elbow River. The traditional Blackfoot name for this place is Makokis, which we now call the city of Calgary. This is traditional land of the Blackfoot Confederacy, as well as Treaty 7 territory, which includes Kainai, Siksika, Piikani, Tsuut'ina, and Stoney Nakoda nations. We would also like to recognize the Métis people and the Inuit people who have made their home here in Calgary. So before we begin, just a few housekeeping items to cover our agenda for today. We're recording this session, so if you want to share it with your colleagues or friends, we will email you a follow-up link in the next couple of days. The recording will also be available on our webpage and YouTube. Our next Innovation Table episode is next week on June 3rd from 2 to 3 p.m. MST. The session is entitled The Future of Sport. We will be joined by Calgarian Olympic legend Mark Tewksbury, David Shoemaker, the CEO and Secretary General of the Canadian Olympic Committee, and broadcaster Scott Russell for a lively discussion on what the future will be for organised sport in Canada in light of COVID-19 crisis, both at an elite and grassroots level, the Calgary 2026 plebiscite, and much more. So the agenda for today is, after this introduction, we'll go into a virtual talking circle, similar to the same format that we did a few weeks ago, and summarize and then close. So our social systems are being disrupted, and there is demand for new ideas, solutions, products, and services that continues to outpace the supply of funding and services. We, in the Social Impact Lab, which is a partnership between J5 and the United Way of Calgary and area, are responding to this disruption by investing in innovation, which we are calling responsible disruption, ensuring that any change that results is considered and fair to Calgarians and communities. Our Responsible Disruption Zoomcasts are a series of discussions with leading players in the social innovation sector and beyond, discussions about communities, systems, and the role of the individual in change. We are now over 2 months into the COVID-19 health crisis and lockdown that has had a huge impact on everyone in Alberta and across the world. Literally overnight, everything we took for granted has changed, from the way that we buy our groceries to the way that we live family life. And longer term, this will have a profound impact on the local, national, and global systems in which we operate. Indigenous communities in Alberta have been particularly badly hit by the health crisis. A few weeks ago, in part 1 of our virtual talking circle, we heard how the Indigenous community has been affected and how they are using their practices and knowledge to respond. Today, we are revisiting that discussion. Those of you who attended the first part of our virtual talking circle will have heard the speakers introduce themselves in the first round of questions, and in the second round, they answered 1 of 2 questions. If you would like a recap on that Zoomcast after today, I'll post the YouTube link in the chat function. To recap, our guests are Dr. Lana Potts, Maracle, Danika Littlechild, Shane Gauthier, Dr. James Makokis, and our moderator will be Daisy Giroux, who is a strategy lead from the United Way of Calgary and area. Welcome to you all, and over to you, Daisy.
Okay, Tansé, bonjour, everybody. Hello, welcome to the second half of our virtual talking circle. As James has shared, all of the introductions were done in the first round. So we're going to get into our second half of our virtual talking circle by inviting our speakers to answer. In the first round, we'll answer a question that was given to us by a participant in the first round. And then the second round, and that'll be the final round, will be just kind of revisiting the questions that were asked in the first part of the virtual talking circle, just to kind of get the perspective of how things have been a month from when we had last talked to our speakers. So first of all, I just want to thank our speakers for joining us again for the second half. I'm so greatly humbled and honored that they came back to join us, and really looking forward to hearing from them. And so we will get started with that. But before we do get into the second half, I just wanted to acknowledge the smudge as a representation of a call to order. And so I'm going to take this time right now to light the smudge so that we can get started in a good way. So I just invite any of you, if you have your own smudge, that you can light it yourself, or you can just smudge yourself with the smudge that I have lit with that good intention that we are starting in this way. So I'm going to go again in order of how I see our speakers on my screen. So you might see the speakers in a different order on your own screen, but I will be inviting our speakers to go around in the order that I see them. So for the first round, I wanted to ask the speakers a question, and we'll give them about 5 minutes each just to kind of answer these questions, or this one question. This question was sent to us in the first half by a participant. So this is the question that I'll share with everyone. So there's so much shifting for the broader community, everything from billions of dollars being released to all Canadians, to efforts of collaboration and care for those essential workers who weren't considered essential workers before this crisis. So I'm asking the speakers, how would you encourage people to be proactive in continuing this spirit of care for community and paralleling the work of decolonization that should be taken a little more seriously once things settle and we overcome this current pandemic? So I'm going to invite Lana to go first. If you can, I'll give you the feather and you can start.
Thank you. Good afternoon, everyone. I'm joining you here in Makokis. And when I read this question, I started to really reflect on what does this mean? And I do teaching around traditional health. And in my own journey of learning and growing, of working in a two-part world and Western as a traditional person, I started to think about what are solutions, and simple solutions are really simple solutions. And I always go back to the way that we lived. There's teachings within our own structures as Blackfoot people, and I speak to you from Blackfoot perspective around our teepee teachings. When you enter a Blackfoot teepee, you enter from the east door, and you enter into the teepee, and there's a role for men, there's a role for women, there was a role for everyone inside the teepee, where they sat, what their role was when they were in there, how you behaved with protocol, where you walked, and this was very taken very seriously, and something you learn over a lifetime. And reflecting on what we're doing in community with giving back and working together and reaching out and recognizing that all of a sudden what we felt was a freedom to roam Turtle Island, to be able to go to the mountains, to be able to go down to the river, all of a sudden was somehow not taken away from us, but redirected, and maybe was not a safe place to go. I felt that people started to look back within their own community, and they started to think, well, what can we do locally? And I think going forward, if we pay attention to those roles, that there was always traditional roles of hunters and gatherers. We had our own traditional policing system, that elders play a significant role in our lives around guidance and teaching. Elders from aged elders to ceremonial elders to spiritual elders. And we really need to start to recognize those roles and impact around creating change. And that change within our community doesn't come from money. It doesn't come from having, being millionaires. It doesn't come from actually, living in cities. It comes actually from that love and connection we have for each other. And I think that's what I really seen. I think it allowed us to ground ourselves locally, to kind of use that teaching of being mindful, being present of where we are and what we're doing, being present of what's important, our family, our youth. Through the messaging, through all of this, we were asked to speak to protect our kids and our elders, protect them from this COVID virus, protect them, provide for them, and really try to educate population. So what we do with everything is around those two demographics in our community. And I think if we continue that on and we remember these lessons with what happened, what is still, I also need to say it's still happening. It is not over. I know there's messaging that's coming that it's somehow, because the government has decided to open stores, it's still here. We haven't really felt the full impact in all the First Nations communities. I know the ones that have been affected, it can be scary. And even those that are dealing with active cases are really banding together to go back to our roots as Indigenous people, reaching out to elders, reaching out to ceremony. And just to remember that through any of this, and that's message only that I would like, if there's any youth listening, is really that's what mattered. At the end of the day, it was knowing where you came from, knowing who you can connect to, and knowing where you need to go going forward. And that's where you'll build strength within yourself. And they talk about reconciliation and reconciliation and these catchphrases, but it's really simple. I believe it's learning your values of where you come from, learning your traditional way of love and honor, of respect, of listening, and really protecting the vulnerable people in our community. And that's what I think can carry us forward and continue to carry us forward as we go into a little bit of a calm before the next storm, because I do believe that it's still there. Well, I don't believe, I do know that it's still here. Unfortunately, it hasn't gone away. So that's really how I would look at it in that way, is going back to really learning where we come from.
Thank you, Lana. Our next speaker is Danika.
Hi, Dansotoya Kakio. It's really nice to see all my fellow panelists again and to see our wonderful hosts once more. Thank you for inviting me back for the second round of the Talking Circle. For me, the answer to the question posed is about enforcing or facilitating a respect, fulfill, and protect framework. And what I mean by that is that we should really oppose any impediments to Indigenous use of traditional preventative care, healing practices, and medicines. I also think that laws, policies, and programs that concern health should be reviewed in partnership with Indigenous peoples, and those discriminatory elements should be removed or replaced. I think that we should see the implementation of the Treaty Right to Health together with treaty-based funding arrangements be brought forward and led by Indigenous peoples. And I think in terms of this concept of respect in a new framework after this sort of transitions for us, after we all transform through this process, we need to think about health determinants. And by that, I mean, there should be no unlawful pollution or contamination of the air, water, or soil of Indigenous territories. So for example, we saw the Minister of Energy in Alberta declare that this was the perfect time to build a pipeline because nobody could go and protest, because you can't have gatherings more than 15 people. This is reprehensible governance, and in fact is, I believe, unlawful. We also continue to see toxics and contaminants being released into Indigenous territories from industries, etc. And so I think in terms of respect, as part of the framework moving forward, those things have to be addressed immediately. And finally, I'll leave it at this. I think that we need to give the space for Indigenous peoples to have their own self-identification and determination when it comes to what a lot of people call data sovereignty. a lot of the data that is generated around health and healthcare is totally lacking and completely unreflective of Indigenous realities, and yet all the funding and all the programs and services are based on those bad data sets. And so we need to see Indigenous peoples have some determination over their own data and exercise what is generally called data sovereignty, so that we get the right funds for our healthcare. And so I'll just leave it at that. Thank you.
Thank you so much, Danika. James.
Thank you so much for whoever asked the question, and it's good to see everybody here today. So I think this is an important question, and when I think about decolonization, I really think about restoring the balance that has been displaced and disconnected amongst our people, whether that's in our governance systems, our education systems, health systems, and things like that. And I think this is an opportunity to look at restoring our own Indigenous health systems and medical systems, but also building, and Danika mentioned this, and implementing our own Western contemporary medical systems, which have been lacking since the Canada Health Act was implemented in the 1980s, and the federal government removed providing primary care services, lab services, diagnostic imaging from our communities. And now we're suffering the results of that, especially in a pandemic. And so moving forward, we need to look at what our treaty was in this area, and that has never fully been realized. And if we're going to survive and build after the pandemic, that we actually need to have a fully functioning health system. And so I think that's a huge part of it. You know, if we think of, you know, the word decolonize, it's actually rebuilding our own, you know, nehiamaskikia, our medicines, and milpamatsuin, our health. And having that is actually having the federal government fund for Indigenous medical healers, Indigenous elders, to be providing that alongside our Western trained health professionals. And that will help to restore the balance for our people. And until that happens, we will never have a fully functioning health system, and our people will continue to suffer as a result of that. And so for myself, when I think of the work that needs to be done, it's actually building a functioning system. I think what also this pandemic has taught us is the need for the huge need for us to bridge the gap between our elders and our young people. And where I see that the most is in our ceremonial practices, which is our institutions of governance, law, education, our health system. And they're not just religious or spiritual practices. And because of some of the limitations on movement that we've experienced in our communities, where we heavily rely on other nations to come and assist us in many of these things, that we need to train our young people to carry those forward into the future. And an example of that is when we think of the importance of our singers at our ceremonies, we often lack young people having the ability to do that. Although we have many young people who go and sing at powwows, when it comes to, you know, being able to do that at our sun dance ceremonies, our Bihau Sibwin, our chicken dance ceremonies, many of our ceremonies that we have, that's where the disconnection occurs. And I think what the pandemic is forcing us to do is look within our own nations and within ourselves in terms of what is our personal responsibility to our nation to be learning and carrying these teachings forward. And I hope that we are able to look at that reflexively and in this way, in a strengths-based approach, to see how we can, how our nations can become stronger after this. Thank you.
Thank you so much, James. Shane, over to you.
Hi, everyone, and thank you, James and Daisy, for facilitating this and hosting this. Well, I read the question a couple of times, and it's two-parter. You know, one is looking at care, continuing the care for community, and paralleling that work, the work of decolonization. So, from my perspective, working in the urban setting, supporting Calgary's most vulnerable community, Calgary's urban Indigenous population. To me, it's partnerships. It's really working with everyone, the community, and it's showing how we're all interwoven and how we have the elders who guide the work, showing value of that knowledge, and you know, we have a justice initiative, addictions, mental health, and I think continuing the work that we started because of the pandemic should continue on after the pandemic, because it will be a new way of doing things. There will be, I think, learnings from what we've had to do since March 16th, you know, with the task force that we developed, with the partnerships that we've created, but also looking at the work of decolonization. And I think a part of that work, from my perspective, is addressing stuff that maybe isn't as palatable or isn't that as pleasant, and that's racism. That's looking at trauma, residential school, or federal policies, the transgenerational effects, or and so I think continuing that work in a good way, continuing you know, with partners on the community, at the community level, also the government level, and also I think calling government and calling other you know, organizations or funders to task, and to question things, and to call people out or call organizations when the time is right, and when it's appropriate, and to ask questions of, you know, what are they doing in terms of policy or practices to address colonization or address trauma, and so on. So for me, from my perspective, from a Friendship Center perspective, as I tell people, it's the Friendship Center, and friendship is in the title. And so I like to look at things from a Friendship Center or friendship perspective, and how we can look at solutions. I mean, we can not just address or look at things that need to be fixed or in that way, but looking at solutions together in terms of with partnerships. And I think it's important to continue the work that we're doing with the partners that we have, and with the community after the pandemic. And looking at, because right now we're looking at a relaunch, you know, as things progress. We went from more of a response or emergency mode of food security and helping folks who, you know, because of the pandemic, you know, exacerbated a lot of things, to more of a coordinated approach, and showing that we can accomplish a lot more as a whole than just individually. So I'll leave it there.
Great, thank you, Shane. And I'm handing the feather over to Lee. Oh, you're on mute, Lee.
Mute. I thought I was unmuted. Anyway, I don't want to get into any arguments with anyone over this, but I will say this, that decolonization, the colony is Canada and it's ours. So if I go to France and I move there, I will have to learn French and their culture and integrate with their laws. If a Frenchman comes to Canada, they will not have to learn our laws, they won't have to learn our language, and they won't have to request permission to live in our territory. So that's the colony, that's the colonization part. And it's land-based, first of all, and it's law-based, secondly, and then it's cultural, and lastly, it's religious. So we have been given some degree of religious freedom, not a lot. Like at University of Toronto, there's about 2 spaces where we can hold a smudge out of a campus that's 4 square miles. We don't have any outside space for ceremony because it's all taken up. Everything happened without us. So now people are asking, well, what do you need? Well, we need to first of all go back to when we were in charge of things and look at what we had. We had absolute access to Takaranto and everything around here that's in the Treaty of the Dish with One Spoon. That's from Montreal to Fort Erie and up north to Lake Simcoe. So we don't have that now. And no European has to abide by any of our laws. That would be legal decolonization. So then we have to think about that. What does that mean? Well, for one thing, take care of the earth. The government of Canada should be made to honor that law. Take care of the earth and take care of it in a way that we know is going to lead to future generations thriving in this country. Secondly, we need access to the land that we once had access to. We don't have that. And lastly, of course, we need the restoration of language and culture. And we need that for Canadians as well, because they would have to have had to learn a language. In fact, in 1905, most Canadians spoke Chinook, which is a language that we developed to help them communicate with us easily. So that being the case, that's all changed now. Everything's about English, and particularly for Europeans and non-native people. Why should we be the only ones that have to make changes in order to so-called decolonize? No, Canada has to make the change. And we have to look at it in a much more global picture of what it actually is for them to decolonize. That's who needs to decolonize. We already know what we need and what we're entitled to. We have to have access to it. So that's a whole different way of looking at it than looking at changes that we need to make to be more comfortable in the colonized circumstance. I'm not really in favor of that. I don't want to be comfortable in a colonized circumstance. Voila.
Thank you so much, Lee. All right, so we'll go to our last round of our talking circle. At our first half of our virtual talking circle, we asked our speakers 2 questions and invited them to answer one, or if they had enough time for both, to answer how has the Indigenous community been affected by the crisis. So they did answer that, but we also asked how is the Indigenous community using its practices and knowledge to respond to this crisis. So we want to invite the speakers to kind of give us an updated answer, because it has been a month since we last heard from you. I invite you to answer one or both, if you have time, on how the Indigenous community has been affected by the crisis, and how is the community using its practices and knowledge to respond to the crisis. So again, I will start with Lana.
Thank you. So I'd like to talk really about from a learned experience around the question around how has the community been affected by the crisis? Because I think what this has done, the pandemic has really shown us where our supports are in the nation. It has shown us where we get our money from, our HR, our infrastructure, and what we really need to help the community. We recognize that a lot of what was done was a very emergency response, getting people in place, keeping people home, but also recognizing that we couldn't keep people home. People need to travel. Our goods and our services are not in our communities. They're in local cities. They're in local towns for groceries, for healthcare. We also learned, I think, where we kind of stand in all of this around getting help and getting support, and the fact that we were, personally, I can say I was pleading with a body of individuals to ask every week for a mask, to ask for gloves, to ask for hand sanitizer. So I think it really showed us that what we learned in community is even though the response was there and they talk about the billions of dollars and people getting CERB and people getting other supports, we weren't getting that in the community. And I found, and I've said this before, is that we're in a crisis mode because of many things, because of loss of land, lots of all these things we can talk about. And we live through this. And I can speak from a health perspective of how people struggle with chronic disease. They struggle with lack of access to many things. And then they were said, get ready for a crisis, protect yourself, basically prepare for the pandemic that we never thought would come. And we realized it affected us. It affected our ability to, in a good way, to work together, but also put a lot of stress on people. It caused, some breakdown in communication and, a bit of isolation, but it also really pulled communities together to recognize one thing they had was to protect themselves. We protected ourselves by, who could come in community was also really policed in some places, how people were behaving in community, setting curfews. And I think they did what they could on a very local level. But it also did speak to us again. And I've said this before, that second and third rate healthcare that's only good enough for First Nations people in community and First Nations people in the city, because we could speak to what's happening in the city around the support they got as well, and in the towns, it wasn't there. So I think it really kind of highlighted this continuing process that we do need more supports. We need supports together, and we need to work together. So I wish I had more positive things to say, but I really seen it kind of pulled those cracks that were already there. It made them bigger, but also seeing we have strength to help fill those within ourselves.
Great. Thank you so much, Lana. So just for all of the participants, we may be able to take some questions after we're finished our talking circle. So I invite any of you, if you have any questions, to put it in the question and answer box, and James will facilitate that at the end. So I just wanted to mention that if you guys had any questions for our speakers, if we do happen to finish early. So the next speaker is Danika. I will give you the feather.
Hey, thank you. I think that there is really extraordinary care being provided by Indigenous-led and controlled organizations right now, and our Indigenous nations for their own peoples. And I think it's extraordinary because many of those organizations that are health organizations are beholden to achieve, at the very least, provincial standards. But what they're often able to do is to go way above and beyond by ensuring respect and support for Indigenous peoples to be in a safe space to receive care. And then also to further support the spiritual and biomedical benefits of traditional healthcare protocols, of traditional medicines, and have the ability to bring unwell Indigenous peoples into contact with the healthcare system in a much safer way than they would be able to do in a mainstream facility. And so I really want to lift up and elevate those organizations that have responded so extraordinarily to this pandemic. And I've seen so many examples across the country. You just have to Google it and you'll see multiple examples of these amazing organizations and these amazing nations that have done so much for their peoples. And I think this is something that has been thought about for a very long time, and in fact is part of the international rights framework for Indigenous peoples. So if you look at Article 31 of the UN Declaration on the Rights of Indigenous Peoples, that article talks about the right to maintain, control, protect, and develop our knowledge, our traditions, our medicines, and our intellectual property over those things. And I think that if we want to consider that framework of moving forward with non-Indigenous Canadians committed to a process of decolonization, we need to elevate the systems of Indigenous peoples and to lift up those health systems that have already been developed in communities in nations on Indigenous territories that are in fact functioning to an extraordinarily high level, above and beyond the minimum standards that are set out in many provinces and territories. And so that is, I think, quite a hopeful thing. And if we can continue to support them, I think that that can bode well for the future.
Great, thank you so much, Danika. I'm going to hand the feather over to James.
Thank you. I think one of the things that comes to mind, right away, just because it happened recently, is what happened in Beardy's and Okemasis, where the RCMP went and invaded a Sundance that was happening. And, how I try to explain this to maybe non-Indigenous people is that, again, our ceremonies are not just spiritual or religious practices. And in that instance, it represents our institution of governance. And so what would the reverse scenario have been if someone who was uninvited went into Parliament that was sitting with their guns on, what would the response have been to that? Because I remember at the height of Idle No More, when Okamau Fox, was going into Parliament with his drum and wanting to go and address about some of the issues at that time, that he was not let in. So there's a huge difference in terms of what continues to happen for our people. And what the community, what the nation of Beardy's and Okemasis was doing was exercising their sovereignty to hold their own, forms of governance, in that case, an instance. And so, because of that, it really brought our people back to the time of Indian agents and those sorts of things, which is very traumatic and stressful in an already stressful situation. So I think now, as people are moving forward in, our gathering times, which normally happens in the summer, which is our ceremonial season and things like that, that people are looking for, I hope that people are moving towards making those safer as our people continue to gather, however that is, and taking precautions into place, knowing that because of our social disparities and social sicknesses of colonization, that our people are at more risk of contracting illnesses due to overcrowding, due to decreased sanitation, all of those social determinants of health that we've talked about. And that, if we're going to continue to go forward with those, which I understand the importance and reasons why, that, we make adaptations to make them safer and draw on people who have experience, whether that's the Indigenous nurses or the Indigenous physicians, and for us to truly work together to protect our whole nations and communities, especially around those important events. So I think that, that from me and reflecting on what's happened and as we move forward, is an area that really has been affected in this crisis, but also to remember that we draw our strength and, hope and all of those things from our practices as well. Thank you.
Thank you so much. Shane, I'm going to offer the feather to you.
Thanks, Daisy. Listening to everybody makes me think about how resilient and how we come together as a group. And when you ask the question about how it's impacted the community, and I look at my staff and look at the community that we support, and I just see things going like the economic shock from short term or the social isolation. And when we're already 2.5 months into the pandemic, for me, talking to my staff, talking to the community, the partners, we're transitioning from something short term to more long term, like looking at strategies for the long term, like assisting our elders with more comprehensive, like food packages and non-food packages to combat isolation, technology plays a key role, because when we're isolated away from our loved ones for a week, that's one thing. But when you're talking about a couple of months, it can have a mental health impact, right? So things have prolonged, and our supports have been going from a basic security support for in a lot of areas to more of a comprehensive, more refined. So for example, we have the ability, we have a coordinator, Lori. So Lori is our task force or COVID coordinator. And so what she'll do is she'll talk to the families. And I said to her, ask the families what they need specifically, whether it be medical equipment or something like a monitor, glucose, something like that. So we're looking at more of a specialized support for the community, talking about the relaunch, because that gives hope. So we have a weekly staff meeting, and we have an elder who does a different elder who does a teaching for the staff, and we talk about hope. We talk about what we're grateful for. Sense of humor really comes into play, and how we're really in it together. And another thing that I've noticed is with the staff is the fear of coming back to the workplace. So we have the office cleaned weekly by a professional company that specializes in, antiviral or bacterial cleaning. So just being proactive and addressing people's concerns in the community and also the staff. And I think a key thing right now, because we're well in, past 2 months, is the mental health part. So we have elders, and we talk about mental health, or we just talk about the components of what we can do to support what people are going through, because everybody's different. And if people can't engage, they can't talk to somebody, or they don't feel safe, or they feel lonely or more isolated, we want to have an open dialogue with our staff and with our community. So that's basically what I've noticed, now that we've been, in this for over 2 months. And it's also getting back to the economic shock. It goes from short term to long term. So we look at helping the community members fill out provincial applications for funding, emergency funding, even federal, and a lot of it is education and awareness. So I just basically do what we can to support the community and refine the modalities, like how we do it, where it went from more of a response to more of a coordinated approach. And I think it's impacted the community, but in many ways, of course, it's impacted the community, but we're also looking at ways to find solutions and be hopeful and also show how grateful we are for what we do have. So I'd like to leave it at that.
Sorry. Thank you so much, Shane. Now I'm going to pass the feather on to Lee. Oh, and I think you're muted, Lee. Or, yeah.
All right. Now I'm not muted. Somebody was also calling me. I'm terribly sorry. I had to get rid of them first. Could you repeat the question just quickly?
Yeah, sorry. So the question was, how has the Indigenous community been affected by the crisis?
Yeah.
And the second question was, how is the community using its practices and knowledge to respond to this crisis?
Okay, I think it's different in different places. People without water obviously have a dire situation. And, the government gave our water money to an oil company, and they're going ahead with tar sands and all of that sort of stuff without funding communities that don't have water. So the colonial practice of not giving a crap about us is still sort of there. But in my family, I'm just fortunate that my children were raised to take care of their elders. So I have a daughter that does all this tremendous research for me, and she sometimes shares it on Facebook, but makes sure that I'm practicing safe things like, washing and, proper ways of washing. Her father's a health practitioner, so he knew how to wash your hands properly. Not very many people, I don't think, knew that. I certainly didn't until this COVID came into being. But also simple things like when you pass someone who's not wearing a mask, breathe out, don't breathe in. I mean, all of these things that we don't think about in our daily lives, we're having to think about now. And I think we're fit for thinking about it because we've had to deal with our health issues on our own for so long. I mean, the government's been negligent from the very, very beginning. But we also have our own medicines. I don't know if everybody's aware, but smudging gets rid of 99.99% of all viral and bacterial contagions, much more than anything out there, including alcohol and, wipes and all of these different things. So we should be smudging every day, and if possible, twice a day. And particularly when we go outside and come inside, we have to be cognizant that our medicines inside the home are our best bet. They're our best bet. And I think sometimes we have difficulty believing that because we've been maligned so much. So it's also addressing the racist treatment of our medicines and looking at the history. I think Canada should admit that it didn't even wash until they got here. They should admit that their health practices stem from ourselves. In fact, we were called savage and dirty because we washed so much and we took our clothes off to wash. This was not heard of in Europe. So, these kinds of things, we need to know these kinds of things to restore ourselves and our belief in ourselves. And I think our medicines will take care of us. That's all.
Great. Thank you so much, Lee. All right. Well, I want to thank our speakers for coming and joining us for an entire segment, a two-part segment of a virtual talking circle through the Zoomcast. And I just wanted to quickly, just reiterate some of the things that they've said. It sounds like this is, even though this crisis that we're dealing with has been challenging and it has been forcing us to work in a different way and see things in a different way, it's really gifting us with an opportunity for change. And it gives us an opportunity to revisit our principles and values, to look at our healing practices in medicine, to look at our own self-identification, an opportunity to restore our own medical system, to really come from a place of friendship and looking at that friendship perspective, going back to how things were and recognizing that all Canadians need to make this change. It's not just our Indigenous people. And then we heard, kind of an updated landscape of how our Indigenous community has been affected and how this is being responded. So I do want to take this opportunity to thank our speakers for humbling yourself and being here with us. We're truly honored and grateful to hear your knowledge and perspectives and you taking the time out of your busy day to share this knowledge with us and our attendants that are on right now, and to everybody else that will be watching the YouTube video once it is sent out. So with that, I want to hand it over to James. I think we have enough time for some questions. So thank you so much. Aye.
Yeah, thanks very much, Daisy. And I'd echo that thanks to the panel for answering the Talking Circle questions. And we've got a couple of questions that have come in from attendees or participants in the Zoomcast. And I'll just read out the first one. It's from an anonymous attendee and it says, Tansy, thank you for the wise words from each of you. In being an urban native, I feel that there is a huge loss of community being in the city. There are programs available, but many consist of registration required or anxiety of joining somewhere new, not knowing how people are. I feel that I'm far from my community, but also have a loss of my culture. How would you encourage us urban natives to connect back to our culture when it feels so lost, especially in this COVID when there is so much chaos and fear? I hear a cry from other urban natives about being so lost from culture and craving it. Any ideas or encouragement? Now, I'm not going to put that to any of you in particular, but if you have an urban experience or an urban background, or maybe Shane is a good person to answer that question about, you know, how to connect to culture and you know, for urban Indigenous folk who feel a little bit disconnected in the urban environment.
Sure. I get emails all the time, and I think reaching out to the Friendship Center, as an example, there's other agencies, and reaching out and just asking about programs. We have video, so because of COVID and we can't have gatherings, we do videos. So we have elders teaching videos. We've got other videos of teachings with honoring the bonds for parents and stuff. So I would think the first step would be emailing, reaching out to an organization, Indigenous organization, and asking what are they doing during this pandemic? What can they offer? You know, ask, what can you offer? Like, what can I participate in? And then that I would go from there, because I get emails all the time. All the emails off the website come directly to me. And so then what I do is I answer them or send them to certain specific staff to reach out and answer questions and engage the community, because we're still doing programming, but it's just modified. And we're hopeful. We're really looking forward to the opportunity and the time when we can all come together again and have a feast, or, you know, have a community event. But that's what I would say. And I would stick with Indigenous organizations, organizations that you're familiar with. That's what I would recommend. Yeah.
Cool. Thanks for that answer, Shane. Danika, did you have an answer for that?
Yes, I just wanted to emphasize the strength that comes from within ourselves. Sorry, my son is in the background.
Oh.
I've been in situations like that and had similar fears. And I think one of the things that we need to do is understand our own power to call our own spirit back. And however you do that is what resonates with you. And so I think having that yearning is very powerful. And I think you just need to honor it in a way that feels right and safe and comfortable for you at this really uncertain time. And to just be gentle with yourself. Really, there's no kind of strange cultural finish line out there. We're all on a journey in our own identities and how we understand ourselves as the days go on. And I just wish you the best and hope that you stay safe and stay strong within yourself, and just hope that you're well.
Yeah, thanks for that answer, Danika. I'll go to another question, if I may, which could be one for all of you, and it just sort of a 1-minute answer. So Joanne asks, who, you know, you're all leaders in various ways. That's why you're on this panel. But who gives you hope and inspiration in this pandemic to keep going, and why and how? Could I put that to all of you one by one, and just sort of, if you can give us a 1-minute answer to that, about who gives you guys inspiration to keep going?
So I'll start.
Okay.
I had a reflective moment in all of my roles as being a doctor, working in leadership, and it was a really simple moment in my life. My son had come to me and he told me, "I don't want you to leave the home. I want you to stay home." He calls coronavirus, and he was scared. And I realized, I said to him, "You know, what I do is I do for you." And I think through that, and what helps motivate me through is really our children. It's really our children, and recognizing their innocence and recognizing what we need to do is protect them. Because every action I take in my life will protect him. Every protection I do, every thought I make, do I choose to wear a mask? Do I choose to wash my hands? Do we celebrate in our home? Do we go for medicine? Is really, really about them and preserving and letting them know where we come from. And I think that's what gives me hope. And also knowing that I come from a place of hope. that my culture, being a Blackfoot woman, where I come from and the land I stand on gives me energy. And that's really where I draw my hope and through the dark days. And I've had many of them. And I've cried. And my close friends will tell you, even Dr. Makokis, I've had moments where I couldn't go on and I didn't know what was going to happen the next day. But grounding myself on our land and grounding myself with being a mother and a protector really helps me.
Thank you. Thank you. Anyone else?
Yeah, I think we all were. It feels like in residency when the, attending physician's asking you, what's a differential diagnosis? And everyone's just too polite to say anything. But I think, for this question, what or who gives you hope, I always reflect on how strong our people are, and that we've got through many pandemics in the past, and that relied on our ingenuity, our ability to adapt and move forward, to be resilient, and all those strengths and characteristics that are in all of our blood memory. Whatever family we come from, we all hold those. And it's important to reflect on that and remember that as well. And that, what this has kind of taught me is that it's kind of time to be introspective and have your own ceremonies in your home with your family, and all of those things can continue on. And that most people have a base for being able to do that, I think that seeing people do that has been very inspiring. And then I also think about my little nephew, Atayo Kanasini, who is, will remember this time, and he loves it because he doesn't have to go to school. But, that we'll look back and say that this is another thing that we got through together. And so I think about him in the future and all those people that were doing this, and all those grandmothers and grandfathers who thought about us so that we would be here today, because in a few years we'll be those same grandmothers and grandfathers, and hopefully we'll have done the right thing to lead our people into that new direction.
Thanks, James. Thank you. Anyone else Shane, you got an answer to that one? Who gives you hope and inspiration?
Definitely the community for me. That's what gives me hope and inspiration. Community, the work that we do, or that my staff, they do the heavy lifting. It really just pushes and pulls me to do better, and to move forward, and to be hopeful, and to know that again, we can do much more together than individually. So that's what really gets me up in the morning and motivates me, and is really just the community and the work that my staff do.
Good, thank you. Lee, do you have an answer to that? Who's your inspiration or gives you hope? You're on mute.
And I have been for 50 years. My reserve is in an urban situation. It's surrounded by Europeans. And I totally understand what that young man is going through. And I'm sure everyone in this group does too, because it's not just that you're urban, it's that you're severed from your original culture. So the first thing that I want to say to him is that internet is full of information about who you are if you know where to look. The first thing I think is singing. Singing is where we all begin. So if he or she could learn to sing in their language, that will lead them to communicate with other people about singing on the web. Facebook's another thing that you can get in touch with and find out who else is in your situation and who's not. Because if you connect with other people who are not in your situation of being divorced from your culture, you can come back home. Last thing is, your nation has elders, and you can find those elders by contacting your nation. So I think that person needed some very practical answers, and looking inside yourself isn't going to give you the confidence that you're a culturally adept person. You need to connect with other people in your nation. That's all I got to say.
Thank you very much, Lee. Which is a great way to end this. So we've come up to time now. It's almost 3 o'clock. So thank you very much. That was a fascinating discussion. It's great to revisit those questions. It's nice to see a bit of progression from the situation that the community found itself in a few weeks ago. So thank you to all of you, and thank you to Daisy also for moderating so well through the virtual talking circle. If you would like to engage or continue engaging with us on any of the subjects, you can do so through Open City, which is our open crowd collaboration platform, or at the Social Impact Lab on Instagram, Facebook, or LinkedIn. If we can go to the last slide, please. So a reminder that next week our innovation table Zoomcast is entitled The Future of Sport, and that will be held as usual on Wednesday afternoon, June the 3rd at 2 p.m. So thank you very much for tuning in, and goodbye to everybody.